Hello everyone, my name is Adriana Nearing, and today we are going to be talking about the importance of screening for the prevention of colorectal cancer-related death. Just a quick disclaimer, I am not a medical provider, and this video is intended for educational and informational purposes only. So if you have any questions regarding your health concerns, please contact your healthcare provider. The topics that we will discuss today are the objectives, so what the purpose of this video is. I'll tell you a little bit about myself. I'll talk about the PA profession. I will also explain what the Healthy People 2030 initiative is. We will discuss colorectal cancer in more depth, and I will also refer to it as colon cancer and also the colon, your large intestine. So all of those terms are interchangeable. And what the symptoms are, so what you feel if you have colon cancer, what you should be screened, or when you should be screened, and what screening tools are used to diagnose, and how colon cancer is treated. So by the end of this presentation, you should be able to understand what colon cancer is, what causes it, what symptoms you may experience, when you should be screened, the tools that are used to diagnose you. So the main tools that we're going to be talking about are colonoscopies and Cologuard. So how you should prepare for these and how they work. And finally, how colon cancer is treated. So I'm Adriana, and I am a second-year PA student, and I'm working on my master's degree at this time, and this presentation is part of my assignment for PA school. So I go to South University in West Palm Beach, but I am originally from St. Petersburg, Florida. And there I went to the University of South Florida, where I got a bachelor's in biology. Before going to PA school, I was an ophthalmology technician. And after I graduate PA school, I'm interested in becoming an ER or an ICU PA, so emergency room or intensive care. And I chose this topic because I have lost a family member to colon cancer. He was the healthiest man I knew, but he was diagnosed at stage 4. And at that time, it had spread to the rest of his body. So he ended up receiving all the treatments and then passed away a few years later. So because he was so healthy, he never really went to the doctors, and he didn't have that, trying to go and get screened. So he started going to the doctor when he was having stomach pain, and that's when they found out that he had cancer. So sort of like him and many other people, for whatever reason that they do not wish to be screened for colon cancer, I would like to provide some education and talk about how important it is to detect colon cancer early so that you could prevent it. So a little bit about the PA profession. We're physician assistants, also called physician associate. The profession is undergoing a name change at this time. So physician assistants are licensed medical providers who practice in all fields of medicine, like primary care, surgery, emergency, urgent care, all of the specialties that you can think of. So like dermatology, cardiology, anywhere you go, you'll see a PA. They are able to diagnose, perform exams, prescribe medications, order labs, perform minor procedures, and also assist in surgeries. So with 159,000 PAs in the United States, patients don't have to wait as long to see their doctor. So if, for example, like if you need to see a cardiologist, but they are booked until a month later, you'll most likely be able to see a physician assistant earlier. So the need for PAs was also high in demand in the 1960s because there was a doctor shortage, and this was probably due to the Vietnam War. So Dr. Eugene Stead, he noticed that some war medics had advanced medical skills that would be useful in providing access to care. So he started the first PA class, which was at Duke University, and they started in 1965. They graduated 2 years later on October 6, 1967, which is when we celebrate PA Days. So on October 6th of every year, give a shout out to your favorite PA. The Healthy People 2030 initiative is from the CDC, so the Center for Disease Control. It strives to well, make people healthier by 2030. So there are goals for many diseases, and my topic specifically focuses on increasing the percentage of adults who are screened in the next 10 years for colorectal cancer in hopes of reducing the number of people that die from colon cancer. So the CDC has a target goal of 74.4% for this specific topic. So by 2030, we hope to have 74.4% of Americans ages 45 to 75 that are screened at their recommended times for colon cancer. The most recent data that we have is from 2018, so that was part of the Healthy People 2020 initiative, and 65.2% of Americans in that 10-year span were screened for colorectal cancer when they had their recommended ages, so at their recommended ages. So before we begin discussing colon cancer, please take a few moments to complete this pre-test. I would like to see where your baseline knowledge about the topic is, and then at the end of the presentation, I will ask you to complete the post-test, which is the same questions, but hopefully you have learned something from this video and maybe some of your interests have changed. So colorectal cancer is the abnormal cell growth in the colon and the rectum. By a journal published in 2020 from the American Cancer Society, they state that colon cancer is the second most common cause of cancer, both in men and women combined in the United States. And there is a higher prevalence, so more people get colon cancer if they are African Americans, Native Americans, and those people with a low socioeconomic status. There's also a genetic factor that increases the chance of getting colorectal cancer. So if you have a family history, somebody like your parents, your siblings, your grandparents, you have a higher chance of getting colon cancer. The elderly are at a higher risk as well. So the older that you get, usually your body kind of slows down, the higher the risk of getting cancer is. And just like any other cancers that it causes in the body, tobacco smoking also increases your risk of getting colon cancer. The 5-year survival rate from the American Cancer Society is kind of depends on when the colon cancer is discovered. So if it is found at stage 1 and stage 2, so those are like the early stages, you have a 91% chance of surviving colon cancer in 5 years. Now, when you get to stage 3, it drops down to 72%. And then when you get to stage 4, it drops all the way down to 14%. So that really big jump from 72 to 14% from stage 3 to 4 is caused by the fact that colon cancer at stage 4 has metastasized to the rest of the body. So that means that it has spread to the rest of the body. So at that point, you're not only treating just the colon, but you are treating the rest of the organs that are affected with colon cancer. So I'd like to kind of spend some time on this picture. I think it does a good job of painting a picture for discussion purposes on how important it is to catch this cancer early and prevent all of the surgeries and radiation and everything that happens afterwards. So this is your colon, or an image or rendering of your colon, and these little things here are polyps and cancerous tumors. So first, we're going to start here at stage 0, and this right here is a polyp. So polyps are just abnormal growths or abnormal tissue that has grown inside of your colon. So we have like the inner part, and then if you see here, it's kind of thick, your colon. So there's a few different layers, and we'll discuss a little bit more about why that is important. So this polyp, it doesn't always necessarily have to be cancerous. Sometimes it's not. But it is right here. It is just on the inside part of the colon. It hasn't spread to the outer layers, and it hasn't certainly spread away from the colon. So this usually it's benign. And it's discovered when you are doing a colonoscopy. So we'll talk more about colonoscopies later, but what happens is, like, if a colonoscopy discovers it, you can just remove it and then you're good to go. You don't have to worry about it. Then when we get here to stage 1, now the cancer or the tumor or the polyp has grown into the inner wall of the colon. So if you can see right here kind of briefly, it's gone into that thicker part on the outside. And here you can remove it with the colonoscopy, so you just kind of snip it away. Also depends on how deep kind of it's been in there. You can just remove this whole part of the colon here, because if you just remove a little bit of it and there's some residual left, then that means it has a potential for growing more. So then we're going to move to stage 2, and at stage 2, you can see that this has gone all the way to the outer wall of the colon. So at this point, even if you remove it with a colonoscopy, there is still potential for more of those cells to be on the outer part here, because the colonoscopy or the little scissors that are at the end of the colonoscopy, it can't cut all the way here. So there's some residual cells left. So at this point, that's just going to keep growing back up. So what they normally do is they just cut this portion of the colon. Sometimes you might also need about like 6 months of chemotherapy just to help with get rid of any potential cells that might have been left over. So now you see stage 3 here, it's gotten much bigger, and not only has it gone to that outer wall, but now it's going to go to these lymph nodes. So your lymph nodes are, they're kind of like filters. They kind of help your body's defense system, so they fight against infection. And then they just lead towards the rest of the body. So it's just basically like a railroad or like a system. It just goes to the rest of the body. So there's potential for that cancer, if they go onto the lymph nodes, to spread. So it's very dangerous at this point, and really the only thing that you can do here is you have to do surgery and chemotherapy. Like at this point, you have to do it just to make sure that all those nasty cells are gone. So when we get to stage 4, this is a deadly part. So as you can see here, not only has it passed all the way past the colon wall, and past the lymph nodes, but now it's gone into the other tissues around the colon. So it goes into the other tissues, it affects the other organs like your liver, your lungs, your gallbladder, all that. The most common site that it metastasizes to, this colon cancer, is the liver. And then after that, it's the lungs. So it's a pretty nasty spread. So as you can see, it's really important to kind of notice how important it is to catch this cancer where it is at these early stages, because at these early stages you can just remove these polyps pretty quickly, or the worst thing is you just remove a portion of this this colon, and you don't have to do the surgeries, or you do have to do the surgeries at this part, but you don't have to do the radiation, you don't have to do the chemotherapy and all that. So it's really important to catch it early, because you'll have a much higher 5-year survival rate than if you catch it at the stage 3 or stage 4. So what kind of symptoms will you experience with colon cancer? At first, you probably won't have any symptoms. Usually it's during those late stages that those symptoms present. And I'm not saying that you're going to have all of these, but potentially you could have trouble going to the bathroom. You can have some blood in your stools. You can have some stomach pain, stomach discomfort, just kind of general pain there. You may have a loss of appetite and weight loss. So weight loss, not only for colon cancer, but for pretty much any other cancer too, is a pretty big indicator. So if you're not trying to lose weight and you're losing weight pretty quickly, that's a possible indication of cancer. Also, unexplained tiredness, so that fatigue, the general fatigue, could be a symptom as well. So the American Cancer Society and the National Cancer Institute, they have guidelines in place for when people should be screened for colorectal cancer. So they recommend different types of screening based on your risk for getting the cancer. So you have people who are at average risk or people who are at higher risk. Average risk means that you're overall healthy. You are at age 45 to 75. So the screening starts at age 45. This was changed in 2021. Before 2021, the screening recommendations were at age 50. So now it's age 45, you start being screened for colon cancer. If your ages 76 to 85, you and your healthcare provider will come to a decision together whether you want to be screened or not. So it kind of depends on your health at that point, and it depends on how you're feeling. If you're over the age of 85, it's no longer recommended, or it's not really needed. However, if you do feel like you would want it, then you discuss with your doctor or with your medical provider, and they'll recommend you screening or not. So if you're at a higher risk, that means that you start screening before the age of 45, and you also are screened earlier than needed. So if you're at normal average risk and you start screening at 45, so you do a colonoscopy, they don't find anything, then you're good to go for 10 years. So you don't have to repeat that screening for 10 years. Now, if you're at a higher risk, you start screening earlier, before 45, and also you repeat your colonoscopies or your tests more frequently, so 3 to 5 years, or depending on how concerning whatever was found was. So people who are higher risk are people with strong family history of colorectal cancers or certain types of polyps that could potentially turn into colorectal cancer. So this might be your siblings, your parents, your grandparents, your aunts and uncles. So if you have a family history there, then you would need to be screened before the age of 45. Also, if you have, for example, a family member, or like your father, let's say it's your father, was diagnosed with colon cancer at age 53, that means that you should be screened for colon cancer at age 43. So 10 years before your family member was diagnosed. So it's a little bit confusing, but so if you're at higher risk before age 45, normally starts at 40, but if you have a family member who's diagnosed, for example, age 53, you start getting screened at age 43. Also, if you have a personal history of colorectal cancer or certain types of polyps, you have to be screened more often. If you have an inflammatory bowel disease like ulcerative colitis or Crohn's disease, you should also be screened before the age of 45 and more frequently. If you have a family history of hereditary syndrome like adenomous polyposis or FAP or Lynch syndrome, then you are at a high risk for getting colon cancer. Therefore, you must be screened earlier. And also, if you've had any history of radiation to the abdomen or your pelvis, then you should be screened more often as well. Now, the tools that are available for colon cancer screening are colonoscopy, Cologuard, the fecal occult blood test, and the fecal immunochemical test. Now, for this video, we're going to be focusing on the colonoscopy and the Cologuard. The fecal occult blood test and the immunochemical test, they are blood tests, and they're just not as accurate. So those are, third and fourth line options. So for the purpose of this video, we'll just focus on the really the better tests, but just know that these other two exist. So according to the Moffitt Cancer Center, the colonoscopy is the best diagnostic tool to screen for colon cancer. So what it is just a flexible tube, and it just goes up from your anus, and it just runs the whole course of your large intestine, your colon, your colorectal area. So at the end of it, it has a little camera. So when the doctor inserts the tube inside you, they are able to see all of the walls of your colon. And if they find any polyps, they can remove those polyps at the same time. So it's like a one and done kind of thing. Now, the downside to this is you need a little bit more preparation for this test. So because they need to see all parts of your colon, that means that you can't have any stool in your colon at that time. So that means you have to flush your whole body before the procedure, and they give you medications to flush your whole system. And this is really important because if you have, for example, a little piece of stool in there and maybe it's blocking a polyp, and then that polyp could potentially be cancerous and it was missed, and they don't want to do that. So you have to make sure that your whole digestive tract is just completely clean. So it's not very comfortable because you're going to be going to the bathroom very frequently. So also this is an outpatient procedure, so you're going to go to the clinic, they're going to do the procedure, and they're going to put you under twilight anesthesia, so it's just going to make you a little loopy. So you're not going to be completely under, but you're going to be loopy. So for this reason, you have to make sure that you have somebody to drive you to and from the appointment, because you won't be able to drive right after the appointment. This procedure takes about 30 to 60 minutes, depending on how many polyps they find and how quickly it goes through. So if there's no findings, there's no polyps removed, or there's no signs of cancerous tumors in there, you will repeat the colonoscopy every 10 years. Now, if there is something concerning or a polyp that just didn't look right, then they'll have you repeat it in 3 to 5 years. It just kind of depends on how bad it was or how dangerous it looked. So this is a pretty nice video that explains the process of how to prepare for the colonoscopy and what to expect from it. All right, I hope that answered some of your questions and made it a little bit easier to understand what to expect during a colonoscopy. Next, we're going to be talking about Cologuard. So Cologuard is kind of different, way different than the colonoscopy, in that your doctor is going to order you a kit. It's going to be mailed to your house, where you provide a sample of stool, and then you just ship that off to the lab. So how it works is that this test detects blood and abnormal DNA in your stool. And a study done in 2014 found that colonoscopy is 92% effective in finding colorectal cancer. So that's pretty good. I mean, if this is a great alternative to a colonoscopy. So it's also very convenient and easy to use. And then it is recommended for patients who are at the average risk. So if you remember, the average risk is patients who are 45 years of age to 75 years of age, and they don't have any other of those risk factors for colon cancer. Now, it is not recommended for patients who are at the higher risk. So if you have a personal history of colorectal cancer or the family history of colorectal cancer, you're not a candidate for doing the Cologuard. And also, if you've had a positive result from another screening method, then you also can't do the Cologuard. So say you did like one of the FIT test or the FOBT test, or maybe you did a colonoscopy and they removed some polyps. So any of those came back positive, then it's not recommended to do the Cologuard. You should do the colonoscopy instead. Now, also, if you have a disease that puts you at a higher risk of developing colon cancer, you can't do the Cologuard either. It's just recommended that you do that colonoscopy just because it's a better test, because again, they can see everything in the colon, so it's less likely to miss something. So this video is from the Cologuard website, and I think it just does a fantastic job of step-by-step going through what the process of providing the stool sample is. So let's just take a look at it. So what are some of your treatment options for colorectal cancer? So it has to be, it is stage dependent, right? So if you catch it at those early stages where you can remove the polyps with a colonoscopy, that's possible. However, once you get into those later stages, then you're looking at chemotherapy, radiations, and surgeries, and also immunotherapies to just help your body keep fighting the cells. So just to recap some of the important points that we discussed in this video, colorectal cancer is caused by the abnormal cell growth in the colon and the rectum. It is highly preventable with early detection, as we saw in those pictures where once you catch it early, it's easier to remove than when you catch it late and it has spread through the rest of the body. The American Cancer Society recommends screening for men and women age 45 to 75 if you're at average risk, and earlier, so starting at age 40 if you are at higher risk, and if you are at higher risk, then you will be screened more often. So colonoscopy is the best choice for colorectal screening, and then Cologuard is a great alternative if you're at average risk of colorectal cancer. And then the cancer is stage dependent for the treatment options. So you can remove the polyps, you can do chemotherapy, radiations, and surgery. It just depends on what stage it was discovered and how it needs to be cured. So please take a few moments to complete the post-test and see if any of your answers changed and if you learned something from this video. These are the references that I used in making this video. And thank you so much for watching. You guys take care.